All right, we are go by the look of it. Welcome. Welcome to this presentation. My name is Eddie Enova and I will be your host, your presenter and facilitator for this session. Now, this talk is on the immune system, and when the immune system goes a little bit wrong, when it gets imbalanced and dysfunctional, so these conditions called the autoimmune conditions. Now, as with all of my presentations, the general disclaimer is that nothing that I talk about or advise in this takes the place of medical advice. So if you come across anything within this presentation that makes sense to you and you want to explore in more depth, please present this to your integrative GP, your specialist or your naturopath, or the whole lot, to see how this may be relevant to you. Obviously, I can't be specific to you because these are very complex chronic conditions, and what causes one person's condition doesn't necessarily cause yours. So this is all information of a general nature to be explored in further depth. Now, some of these concepts are very complex, in particular the immune system, and I'm trying to make it as simple as possible. So when I do present, some of this immune system stuff for the practitioners out there, and I know there'll be a lot of practitioners watching this. I know it sounds very simple, but this is designed for the general public. I know it's more in depth than this, but this framework helps you to understand the immune system, how it works, so we can start to see where things go a little bit astray and how we need to bring balance within the immune system. So let's get started. Let me just make sure the slides are going to work on me. They are. Let's go back one. Okay, so the layout of the presentation is we're going to have a look at some of these drivers of autoimmunity. First of all, we're going to go for a little bit of a deep dive into the immune system and how that works. And when it goes out of balance, what can happen and occur within the body. And then we need to have a look at why this happens. So some of these driving factors, everything from genetic to dietary to stress. And we're going to be focusing quite a bit in one section of the presentation on stress, in particular what's called Psycho-Neuro Immunology. Big long word, I know, but this is essentially the science that's behind the role of stress and how it impacts your immune system and helps to create imbalance in there. So we're going to explore that through the lens of what's called the polyvagal theory, which helps you to understand stress on a really deep level. So hopefully if I do my job well, you'll understand it really well. And honestly, you'll probably understand your immune system, the way that stress impacts it, more than your psychologist, more than your GP, and more than your specialist. And this is really important because we need to make some big changes to our lives to get over these chronic complex conditions. And hopefully the information, the way that I present it, helps you to do so. So a little bit about me. I won't bore you too much. Most people know who I am, but my name is Eddie Enova. I am a naturopath. Within my practice, I see lots of very unwell people, in particular people with a diagnosis of cancer. So oncology is a bit of a special interest of mine, as well as autoimmunity. I've treated hundreds and hundreds of autoimmune patients. It's something that I love to work with people with. And when I get to hear these people's stories and see why they're unwell, I take a lot of joy in helping coach and mentor these people back into a state of balance within their immune system, but also in their life as well. So hopefully through this presentation, you'll be able to get a taste of my experience and the way that I approach things. And if you want some help, you can always reach out. Now, at the very end, I'm going to do a shameless plug for a program that I have. Of course, I have a program for autoimmunity that may or may not be appropriate for you. So at the very end, I'll give you a very brief rundown of that. And if you want more information, you just reach out to me and I will provide that for you. So are you ready? Are you holding tight? Let's get into it. So what is this thing called autoimmunity? Okay, so let's have a look at the definition on the screen here. Autoimmune disease is defined as the development of an autoreactive immune response against self-tissue. This results in chronic inflammation and tissue damage that manifests symptomatically depending on the afflicted tissues. Lots of big words. What does it mean? So autoimmune disease is defined as the development of an autoreactive immune response against self-tissue. So an autoreactive immune response, the immune system is overactive, and instead of attacking a pathogen that it's designed inherently to do, it turns on ourself and it starts to affect our tissue, so self-tissue. So it's an allergic response or an immune response directed at our own tissues. And as you'll see soon, this can be in many different areas of the body, from the skin to the thyroid, to the intestines, the colon. It could be to the nerves. It could be systemically as well. We're going to have a look at how that works and the different parts of the immune system that make that happen. So we understand what sort of autoimmune response that you might be having and the approach to helping to resolve that. So this immune reaction to self-tissue, to ourself, results in chronic inflammation. So one of the big hallmarks of autoimmunity is this inflammation, either in a very specific area like the knuckles and rheumatoid arthritis when it begins, or the thyroid in like a thyroiditis, or it might be the nerves like in MS. There's chronic inflammation, which causes a whole host of functional issues, which we then get to experience as symptoms and signs of the condition. And it would depend on which tissues that it actually affects. And it's a really interesting condition, autoimmunity, because the same thing is driving most people's autoimmune conditions, yet for one person it manifests in the skin like psoriasis, and for another person it's in the nerves like MS. Then someone else like lupus, it tends to affect multi-systems. So it's really interesting, and there's not a huge amount of understanding of why in one person the skin gets affected and why in another person the nerves, and someone else the pancreas, like in type 1 diabetes. Don't fully understand that yet. I have my own suspicions to do with the microbiome, our bacterial balance in these different tissues, potentially playing a part in that. But it's a really, really interesting area of research that still comes up a little bit blank. When it comes to the treatment, though, it doesn't necessarily matter too much. Obviously, there's symptomatic things at the tissue that we can do to help, but we've got to treat systemically. We've got to treat the immune system. It's an immune system problem. So let's keep moving. Now, if you haven't noticed already, I can waffle a little bit. I'll probably get really off track, but I like that because that's where we start to look at some of the juicier stuff. Now, if anything comes up in this and you want to ask questions about it, obviously it's not live, so you can't ping a question to me. Please email me the question, reach out to me through Facebook, Instagram, my website, email info@eddieenova.com, and I'll answer your questions. Please do. I like when people do. So let's keep moving. What's next? The ologist issue. And this is what I was alluding to. So this is something that I see really commonly, is that by the time someone comes to see me with the autoimmune conditions, they've usually been to an ologist of some sort. And there's lots of ologists out there. Now, medicine, unfortunately, is highly specialized to the point where it's starting to lose the point or lose the bigger perspective or the holistic nature of the human organism and human health, which is holistic. You cannot separate mind from body. But medicine, because of its roots in reductionism, it likes to break things down to its individual parts and systems, and then a specialist gets assigned to these systems, and they're called the ologist. So that could be the gastroenterologist, who focuses mainly just on digestive system issues. You've got the dermatologist, who his special or her special interest is the skin. You've got endocrinologist, who is involved in the endocrine organs or hormone producing organs of the body, like the thyroid, the pancreas, and what have you. You've got the neurologist, to the nerves and the nervous system, and the rheumatologist. Now, there's some conditions out there, and you can end up in any one of these, maybe not all of them, but some of them. You can go to a gastroenterologist or endocrinologist or rheumatologist for the same condition, and sometimes get a very different diagnosis from them. So you're speaking with a naturopath, or you're watching a naturopath here. So I appreciate the need for specialization and to understand what's going on at that deep level. But because I work from a holistic framework, the name of the disease isn't as important to me. There is a multi-system, whole body dysfunction, imbalance in the body, and we need to bring it back into what's called homeostasis, which is an innate state of balance that the body always drives towards. Now, in autoimmunities in particular, there's an imbalance or an absence of homeostasis within the immune system. So we have to look at that human being in all their beautifulness, and understand why that their immune system is out of whack. And to do this, we have to understand the patient, not necessarily the disease state. The ologist is a pro in the disease state. For me, I pride myself on being a pro with the human. So it's a slightly different take on it. I'm going to talk a little bit more about this soon. So all these ologists are valuable and they can help you, but most of them will treat symptomatically. Any honest specialist or doctor will tell you that when it comes to the autoimmune or the chronic complex diseases of the modern world, the modern maladies, they don't have a lot of treatments that will cure you. They will manage your treatment, so symptom management to make life livable and quality of life be as good as possible. Now, for me, that's not good enough. I want to help people to get well, and it is 100% possible to reverse your autoimmunity. Is it easy? Absolutely not. It takes a huge amount of work, massive changes in your life, the willingness to change your diet drastically, your lifestyle drastically, to look at the way that you perceive the world and your stress levels. We're going to talk all about this and how that interfaces with your immune system. So looking at your trauma background, your belief systems, your coping strategies and adaptations, and to pull those apart, understand them and relearn them. This stuff's not easy. It takes a lot of work, but where there's a lot of work involved, there's big reward as well. And this is the journey. If you want to, you can go down. If you're looking for a magic pill to take the inflammation away in the immune system to become to balance, I'm sorry, but it doesn't exist. There are no magic pills at all, except one thing, and that's you. So I always say this to my patients, that you are the magic pill. You can do the most amazing things. And I've seen it time and time again with autoimmune conditions, with advanced stage 4 cancers. People can get the results. They can get into a remission. They can get cancer-free, autoimmune-free, depression-free, anxiety-free when they put the effort in. You don't want to be relying on an intervention, a practitioner. The power to heal is within, and when given the right framework and support to make these massive changes in your life, phenomenal things happen. The body will respond. But always remember, your body is always driving back into homeostasis, which is that balance point. That's health. Optimal health is pure homeostasis within the body. Anything outside of homeostasis, which is imbalance, is a disease state. There's signs and symptoms, which is your body's call to come back in to maintain homeostasis or make changes in your environment to come back into homeostasis. So this is what I do with my patients. It's not easy. If you're up for it, I'm up for it. I encourage you to go down that path. So let's keep moving. Sorry, waffling again. So let's have a look at what a healthy immune system looks like. Now, I've got to talk to you about the immune system. So there's no such thing as the immune system. Crazy. Sounds crazy, doesn't it? But there is an immune system. There are immune systems. There's multiple immune systems that come under one umbrella term called the immune system. Now, the analogy that I use is, think of the military. Within any country has a military. Within that military, you have the army, the navy, the air force, all with different roles within the umbrella term, which is the military. Now, your immune system is that umbrella term, and you have different departments that have different roles within the body. And the two main ones that I want to talk about, so we understand what's going on and driving inside of your immune system, is what's called the humoral immune system and the cell-mediated immune system. So starting on the right-hand side of the screen, the cell-mediated, this is a tissue-specific immune system. So it happens at the cell, inside the cell. It's an intracellular immune response. It uses T lymphocytes, so the cavalry, the ones that come in, the cytotoxic T cells, the natural killer cells. This is your antibacterial, your antiviral, your antifungal, and also your anti-cancer immune system. People that have dived into this a little bit deeper would know this as what's called the T helper 1 immune response. So it's very, very specific. It's a localized immune response, very, very important. Keeps us well, kills pathogens, happens inside the cell, the main points. Now, the opposite side of the immunological scales that we're looking here on the screen is the humoral immune system. Now, the humors of the body is an old sort of medico term. It's not really used overly much, apart from in this sort of scenario. And the humors of the body are the liquids of the body, the lymph and the blood. Okay, now this is a systemic, because it's in the fluids of the body, the fluids go around the whole body. So this is a systemic immune response. It doesn't use T cells, it uses B cells. The B cells are the immunological memory, or the cells that produce our immunological memory, which are called antibodies. Okay, so the little blueprints, we get exposed to a virus or something, and B cells go, right, what do we got here? Let's have a look at it. Let's figure out, how does this thing work? Okay, there's a weak link. This is how we kill it. Make a little blueprint called an antibody, and that gets secreted by probably the millions into your blood floating around. Everything you've been exposed to, there's probably an antibody in your blood floating around, a little blueprint. So if you ever get in touch with it again, the immune system knows what to do. That's the B cells that do that part of this humoral immune response. It happens outside of the cell, in the fluids. So it's about memory. And if you go deeper into this, it's also known as the T helper 2 immune response. Now, every day, these immunological scales go up and down depending on how we interface with our environment. So if we go to Coles, the supermarket, and we grab a trolley, and the person that used that trolley just before we grabbed it had a cold, and they were sneezing and snot was flying out of them everywhere, and that trolley, the handle of the trolley got covered in snot. Okay, and now you've grabbed that trolley handle, and now you've got someone's snot on your hands. Uh-oh, now what? You get an itchy eye. So itch your eye. Oh no, now you've got someone's snot inside your eye. Someone's bacteria, potentially a virus, has entered your body. Your immune system is alerted. Your humoral immune system, the B cells, go to the site. It's got, oh, look what we've got here. Quickly, we need to understand this. We need to present this to the cell-mediated T cells. Here, look what we've got. This is how you kill it. Let's also make a blueprint and shove that away into the blood so we never get infected by this again. But here, T cells of the cell-mediated immune system, this is what you do, how you kill it. So your T cells go into action like the cavalry to kill it. The cytotoxic T cells or natural killer cells, what have you. And so the infection should come back out of risk, so you should defeat the infection, and these immunological scales come back into a balance. And that's the most important point here, is that your immune system must be balanced. A strong, robust, but balanced immune system. And that's what, if you see in the triangle in the middle, you've got the Tregs there. These are regulatory T cells. They play a really important part of regulating the immune system, as their name sort of implies. Okay, but this is where now the allergy spectrum comes in. As soon as we tilt these scales one way or the other, we're now on the allergy spectrum, and this will manifest in the body slightly differently depending on which way it tilts. So let's have a look at both ways. Okay, the first way, what have we got strong here? We've got the cell-mediated on the right-hand side being over-dominant. See the seesaw is nice and high there. So it can become overactive. Now, when this happens, that antibacterial, antiviral, antifungal activity becomes very, very strong. So obviously, if you were exposed to a cold and a flu, you would want this to happen in your immune system to kill that bacteria. But what would happen if it stayed overactive for too long? It's going to start to attack your own tissues. So no matter which way these scales tip out, either way, when it's a full tilt, and obviously there's everything in between that full tilt as well, but when it's full tilt, the immune system starts to attack your own tissues, and it starts to manifest in slightly different ways. We can also have the other scenario. And we've got the humoral immune system on the left there, overactive. And then we have a cell-mediated, typically underactive. Usually when one's up, one's down. That's very, very common. So imagine if your humoral immune system, your systemic B cell immune system's overactive, yet your cell-mediated, your antibacterial, viral, fungal activity is very, very low. What do you think that's a recipe for? Chronic infections, getting lots and lots of colds and flus and struggling to get over them. So let's have a look a little bit deeper. So depending on which way your immune system polarizes out, so either this way or this way, you're going to get a different manifestation of an autoimmune condition. So when the cell-mediated immune system is too high, like we've seen on this scale here, we get a tissue-specific autoimmunity. So for whatever reason, which we don't fully understand, the cell-mediated likes to attack one patch of tissue. So it could be the nerves in MS, it could be the small intestine and Crohn's disease, it could be the large intestine and ulcerative colitis, it could be the epidermis and psoriasis. What else could it be? The pancreas and type 1 diabetes. There's many, many different sorts of autoimmune conditions, yet the same thing can be driving that, or is driving that immunologically, and that is an overactive cell-mediated immune system. This T helper 1 response attacking a very specific patch of tissues. Obviously, as we've seen, the opposite can happen too, and we can get a very active humoral immune system, like on the left of this scale. Now, remember, this is the systemic immune system, so we start to see systemic autoimmune conditions. Okay, not these tissue-specific, but the systemic ones like lupus. What else? We've got scleroderma. We've got rheumatoid arthritis, swings that way. It starts off tissue-specific, then it starts to go over. Ignore the multiple sclerosis on the humoral systemic immune system. It shouldn't be there. It's over the other side on the cell-mediated organ-specific. You can see all these ones are very specific patch of tissues being attacked. The opposite side, the humoral, are the systemic ones. We're seeing multi-system immune activation. These ones aren't fun. Both of them aren't fun, but if I had to choose one, it'd probably be the organ specific. These people tend not to get colds and flus. And if they do, they barely suffer whatsoever. Why would that be? Remember that cell-mediated immune system, antibacterial, viral, fungal activity, that's overactive in these cases. Bacteria, viruses, fungus don't stand a chance within the body. And so these people, when you question them, they can't even remember the last time that they got sick. It's been that long ago. Now, typically when these people, if they get pregnant, now they can become very hard to get pregnant when you're a female trying to get pregnant and you're in this autoimmune state, cell-mediated, sometimes it's very hard to get pregnant, but if they do, what typically happens is that their autoimmune condition disappears because there's a shift in the immune system of a pregnant woman that goes towards that humoral. So those immunological scales go from that dominance in cell-mediated, you get pregnant, there's a immunological shift that goes the other way, and magically their autoimmune condition disappears. Very, very common phenomenon. And then they give birth, and then a certain time after that, typically their autoimmune system bounces back because the immune system polarizes back out. And there's reasons for that. Very in-depth conversation, we can sort of touch on it, is that immunological shift from T helper 1, cell-mediated, being too dominant in pregnancy is not a good thing, because what's growing inside of a pregnant woman is a little fetus, a little foreign body, a little parasite, essentially. Your cell-mediated immune system's job is to kill parasites, to kill bacteria, foreign bodies, essentially. And so people with that predominant immune system, one will probably struggle to get pregnant anyway. But if they do, then that shift will happen. That autoimmune condition dissipates or disappears to maintain that pregnancy. So it's a normal immunological shift that happens in pregnancy, and we see this in autoimmune conditions happen. Okay, so it's a little side note there that you might find interesting and help to explain. If you have had a autoimmune condition and you've been fine when you've been pregnant with one of your kids and then it bounces back, this is why. So again, it's just showing that that wobbliness of that immune system. Those immunological scales aren't solid enough. So we've got to solidify those scales, get them strong, but get them robust and modulated, balanced. Most important thing. So different sorts of autoimmune conditions. The good thing is the treatments are basically identical. They're very, very different when treating from a holistic way. We're just looking at immune system dysfunction, and it needs to be balanced. So they're very, very similar, if not identical treatments, which we'll get to soon. Let's keep moving. So why does this happen? Let's have a look at some of these driving factors. There are a certain genetic component to this. So there are certain gene complexes, they're called the HLAs, human leukocyte antigen, and these are certain proteins, gene complexes, which help the immune system recognize different sorts of pathogens. And these HLA genes can sometimes have little mutations to them, which then become predispositions for developing a autoimmune condition potentially. So it's not all about genes though. The second bullet point here, the epigenetic factors. Now you can have predispositions, but these predispositions don't have to be fate. So many people that have these HLA mutations, they may have them but not have an autoimmune condition. So why is that? So a good way to think of epigenetics is your genes, your genetics is the hand of cards that have been dealt to you. Whether or not you play these cards or not is dependent on the epigenetic triggers or factors in your life. So it's the way that you live your life, how you eat, how you breathe, how you move, the people you associate with, the products you stick on your skin. It's the chemistry of your life feeds into the body and helps these genes to express or not express. So when I was talking about if you're up for the challenge of getting rid of your autoimmune condition, it takes massive change. What we're changing is the epigenetic chemistry of your life. So it takes life change to get rid of these chronic complex conditions, in particular these ones. So these genes can be there, but they don't need to be your fate. Okay, so these, yeah, that's enough said on that one. So hormonal influences, women tend to get autoimmune conditions more than men do. which are suggesting that the hormonal factors play a big role in development. Many factors around that which are really, really interesting. I think it also ties in with a stress component, which we're going to talk about soon, and women and their emotional nature, and also with the modern world, the added stresses that are placed on women, especially trying to create a career, balance a family, and all these things. And then you add hormones on top of this, the menstrual cycle, which can intensify the stress around all these things. I think that interfaces with your immune system in a powerful way. And we're going to explore this when we have a look at the polyvagal theory and your immune system and how that works. Stay tuned soon. So we've got environmental factors. So there's certain toxins in the environment. You know, we live in a toxic soup, and this chemistry, this foreign chemistry, when it gets inside of our body, influences our chemistry, influences our genetic expression, it influences inflammation levels and all sorts. So some of the environmental factors that have been shown to exacerbate, cause, or be correlated with autoimmune conditions are things like cigarette smoke and all the goopy stuff that's in there. You've got silica, asbestos, you've got heavy metals like mercury. An example of that is mercury is a very, very potent neurotoxin. In MS patients typically have very high mercury levels. This can come from amalgam in their mouth. Sometimes they've inherited this from mum through the placenta, through her amalgams and exposure, sometimes environmental as well. But the main source is through old amalgams. It's a potent neurotoxin, so that can then start to attack nerves. Like in MS, there can be an immune activation within the nerve sheath. That's a condition called MS. So there's correlations with mercury there. What else you got? You got dioxins, inhaled air pollution. They've all been linked with autoimmune development. There can be infectious agents. So infectious triggers are proposed to invoke autoimmunity by causing cross-reactivity between proteins expressed by the pathogen and the host. So it can trigger an overreaction of the immune system. So quite often people have had a lot of things going on, all these factors that are deteriorating their health, and then it's like the straw that breaks the camel back as the infection comes in and everything blows out, and then the immune system gets overly polarized, and now they're dealing with a diagnosis of autoimmunity. So sometimes that's the case for people. You'll see with autoimmunity, there's never one cause. I like to think of these chronic complex diseases like a mosaic. So we've all seen mosaics before. You may have made one where you break up lots of tiles or individual tiles, and there's a big picture, which is the mosaic, but there's the individual parts. Some are big parts, some are small parts, but it's made up of parts. If you reflect on autoimmune condition or any chronic complex condition, you've got the disease picture, the whole mosaic, and then you've got the individual causes or the individual tiles or parts. Some are big causes, big tiles, big individual parts. Some are small, little ones, just complementary little supplementary causes that have a huge impact. But you add all this up together, the synergy of that creates this disease picture. My mosaic or disease picture may be different to your disease picture and needs to be treated in a different way. This is why it's so important to holistically look at people's health, especially with these chronic complex conditions, and address what their big tiles are first, because they're the big return on investment items that you want to focus your main attention on, because when you deal with them, they have a higher return on investment for your disease state. So you start to feel better quicker rather than fluffing around with the small ones. Now, humans like to do the least amount possible. Typically, it's just what we do, creatures of comfort. So we want to focus on those little small ones. We don't want to do the big ones. Oh, I really don't want to look at the job that I hate, that I'm stuck in and I don't want to change, or I don't want to go to marriage counseling, or I don't want to change my diet. Big ones that are tricky. We all struggle with that stuff, even me. But when we do, that has a massive impact on the disease progress or regress. So highly worthwhile working with someone to understand your disease picture and what the big return on investment items are, so we can start ticking those off and start to get you back into a remission and to total regression and a disease-free life. Chronic stress, really, really big one. I've got a huge history with stress myself, and I understand the impact it has on human health. I've treated thousands of patients, and the beautiful thing is I get to spend a lot of time with my patients, and I get to hear their biographies. And I'll talk about this in a bit. And when you get to listen to these people's stories, there's a common theme with modern humans. It's stress, stress, and more stress. We're all under it. Some of us deal better with it than others. Some of us sort of, cup of concrete, harden up and get on with it type of thing. But it's there and it has a massive impact in human health. It releases inflammatory chemicals which flare the body up. It weakens the body, messes with our hormones, many, many factors. Essentially, it interfaces with your immune system in a really powerful way. And we're going to explore this in a minute. Let's keep moving. What else? Microbiome. What is the microbiome? This is your balance of all your bacteria within the body. Human body is made up of somewhere around about 100 trillion cells, something like that. Now, believe it or not, you've got 10 times that amount. So whatever that number is, 100 million times 10, lots of zeros, that's the amount of bacteria you've got on and in you. Every tissue, every vessel, every organ, every nook and cranny of your body is pickled in bacteria. You are more bacteria than you are human, believe it or not. So it's very, very important that these bacteria are happy, because if they're happy, you are happy. If they're not happy, your body won't be happy. Now, about 80% of your immune system is derived in the last 2 foot of your small intestine, okay? It's called the gut-associated lymphoid tissue, or GALT. And it's the way that your microbiome interfaces with the external world, which is basically from lips to the other end is the external world. So the way that your microbiome samples the environment, the external world, and understands, is it safe, is it not safe, do I need to launch an immune response? It's doing this constantly, keeping you safe. And the health of that bacterial balance will depend on how calm and regulated your army is, or is a little bit trigger happy. This is where gut health comes in, microbiome balance within the whole body comes in, and how we start to modulate, work with, change your bacterial balance in the body. We can have big impacts on your disease state and your levels of inflammation, your mood, and all sorts of things. So it's a really big area of science, microbiome research, and the way that we deal with the biomes of the body. You have a biome in your mouth, you have a biome in your gut, you have a biome in your bum, probably. We do, absolutely. There's biomes everywhere. So the way that we work with our biomes is really important. You just remember, you're a big skin bag of bugs. So take care of them. A really big one, obesity. We have a globesity epidemic. The rate of obese people in Australia and America is through the roof. It's very, very sad. Children are very, very overweight. Body fat is highly inflammatory. It produces inflammatory chemicals are called IL-6, interleukin-6, interleukin-17, and these things flare the body up. Do they cause autoimmunity, or do they make autoimmunity worse? Probably both. One of the best things you can do just for general health is to keep a lower body weight. Now, this can be really hard too. When you're in pain, when your body's inflamed, your body may not like to lose weight. So we have to look at lifestyle change over the long term to manage our weight. But one of the best things you can do is to drop some kilos, and this will help an autoimmune condition massively. Let's keep moving. A few more. See, there's lots of driving causes. See what I mean? This mosaic, there's lots of puzzles, and not all of these are important to you. You can get very, very skinny people that get autoimmune conditions. Now, weight loss, obesity is an issue for them. It's not a tile, or if it is, it's a tiny tile. But for them, stress might be through the roof, or for someone else, pollution might be through the roof. If they're a farmer and they work with all sorts of chemicals that they're exposed to, or a painter or a printer. So this is why it's so important to understand what's driving your condition. But these are some of the factors. What have we got on this page? Dietary factors. So lower intake of vitamin D and antioxidants, as well as higher intake of sugar, sodium, red meats, protein, and iron have been associated with autoimmune development. Vitamin D, really, really important. Okay, vitamin D, remember the immunological scales, they go up and down. Remember that center bit, that center triangle, and had the Tregs in there. Vitamin D is very important for the balancing, okay, for that center bit, the regulatory T cells. I call vitamin D the chill pill for your immune system. Very, very important. I've not met an autoimmune patient yet that hasn't been deficient of vitamin D. It's that important for the balance of your immune system. Now, most people think vitamin D is all about bones, strong bones. That's like a tiny bit of the puzzle for vitamin D or its roles. One of the main roles of vitamin D within your body is an immune modulator, an immune regulator or balancer, okay? Very, very important. In Australia, the reference range is 50 to 150 nanomoles per litre. It's a simple blood test. Your GP can do that for you. A specialist can as well. Medicare covers one test a year that you can get done for free. Otherwise, you have to self-fund it. It's about $50. Highly, highly recommend you get your vitamin D level checked. Everybody, it's an epidemic in Australia, vitamin D deficiency. Get it checked and get your levels between 50 and 150. Ideally, if you've got a chronic complaint like autoimmunity, I like for you to be in the realms of 150 to 200 nanomoles per litre, the top end, not down the bottom. Most average Aussies, if you're Australian watching this, coming in around about 50, 60 nanomoles per litre. So remember, the reference range is 50 to 150, so it's just enough. My question for you is, are you okay with just enough health? Obviously not. You want optimal levels or optimal health. So to achieve this, we need to get the vitamin D up into upper echelons so we get that nice immune system stability. Talk to your GP, get the blood test done. If you need advice on how much to dose for how long, reach out to me and I'll tell you what you need to do. So what else is in this dietary factors point? Conversely, a higher intake of fish and omega-3 essential fatty acids, leading to higher serum levels of fatty acids, have been consistently linked to decreased risk factors for autoimmune disease. The EFAs, essential fatty acids, the omega-3s, fish oil, you can get plant-based ones as well, algal oils, and also plant-based ones like flaxseed can be converted into these, not very well, but it can. These are probably your highest return on investment supplements. If you're going to spend money on a supplement, fish oils are probably one of your best ones too. It's got a huge impact on the body, from your brain function to cardiovascular health, the decrease in inflammation levels in the body, especially when you dose it at a higher dose, a good therapeutic dose. It's very, very useful, in particular with autoimmunity, to help decrease inflammation. Essential fatty acids, omega-3s are fantastic. So a nice strong dose, 1.2 grams of EPA, which is one of the components in fish oil. You have EPA and you have DHA, different roles within the body. The EPA, eicosapentaenoic acid it's called, is what's called a COX-2 inhibitor. It inhibits cyclooxygenase 2, which is an enzyme that creates inflammation. It's what Nurofen or ibuprofen interferes with and gets anti-inflammatory action. Fish oils do it as well. Just got to get the dose right. About 1.2 grams of EPA a day can be fantastic. Now, if you're on blood thinners, be careful with this. Talk to your GP first or your naturopath. Okay, so that's not a blanket statement. Everyone takes it. Some medications, in particular anything that thins the blood, you have to be careful with, because fish oil can also make the blood a little bit more viscous and not clot so well, which can be a good thing for some people. Talk to your GP. Okay, some medication use. Let's have a look. So while evidence demonstrates pharmaceutical medications can cause autoimmune diseases to exacerbate or develop, the exact mechanisms causing this are still unclear. So what have we got? We've got some estrogen. So hormone replacement can sometimes increase autoimmune occurrence. Allopurinol, a gout medicine. Calcium channel blockers. These are blood pressure meds. Statins, cholesterol lowering meds. Omeprazole, which is a PPI, which is a proton pump inhibitor. It decreases stomach acid. Non-steroidal anti-inflammatories. These are things like Brufen or ibuprofen and tamoxifen, used for breast cancer patients. Now, all of these drugs are super common drugs. You know, blood pressure, cholesterol, reflux, inflammation, the pill, tamoxifen. You know, breast cancer is going through the roof these days, with almost 1 in 2 women in Australia getting breast cancer. It's crazy. These are really common medications that have been implicated to potentially develop or exacerbate, make worse your autoimmune condition. So many people are on these things. So if you've got an autoimmune condition and you tick some of these, boxes of what meds you're on, talk to your GP, get a medicine review, get the pharmacist to maybe do a medicine review and to see, are you being over-medicated? Do you need to be on this? If your doctor says that you do need to be on it, then start working on the underlying factors, which will mean that you don't need to be on them. And this is out of the realms of your GP and in the realms of your holistic health practitioner, like a naturopath. Let's keep moving. So, as I was talking about earlier, I get to spend a lot of time with my patients. So the way that I roll is that I have a very, very complex, maybe not complex, but a comprehensive health questionnaire that gets sent out to my patients before they come and sit in front of me. It takes about 45 minutes to fill out. It asks every question under the sun, because I don't want to get that person in front of me and then spend an hour asking these questions, because one, that's boring as batshit for me and also for the patient. So I get them to fill that out at home, send that through to me along with any blood tests. So when they're in front of me, I can put my pen down, I can face them and attune to them and listen to what's going on in their life. And this is a very, very important point, because you need to understand not necessarily the disease state that's presented to you, but the patient that presents to you. So to do that, I need to listen to their biography. Where have they been? What's their marriage like? What was their childhood like? Was there much trauma in there? You know, what are their stresses? What are their struggles? All these factors, play a really important role. And when you listen to these people, you can see why disease states manifest in people's lives and why they're here, and maybe what they're here to actually teach that patient. So it's not the what of what's wrong with them. It's so easy to go to a practitioner, and the ologists are fantastic at this. They focus on what is wrong with you. What is the broken bit and how do I manage the broken bit? Whereas that is important, but the more important question is, why is it wrong with you? If this is just a deviation from homeostasis, the innate balance of health, what is the body calling for? What changes in your life, your epigenetic environment? Does your body want to bring you back into homeostasis? And how do we do this? This is the why. And this is a conversation to have, not question and answer, not a prescription, but a conversation to understand what is going on in this human's life and why is this disease here. There's a beautiful quote by Carolyn Myss. She wrote some books called Anatomy of Spirit, and it's very famous, and I love to quote it all the time. Your biography becomes your biology. And when you listen to people, you can absolutely see how their biographies lead up to a diagnosis of something, whether it's autoimmunity or a cancer. And then when you understand that, you can start the work of changing the reasons why. This is how you recover from these chronic complex conditions. This is why it's not easy. It's really, really hard, because generally your body wants big changes from you. Keep moving. The stress response. So let's have a look at the link between stress and disease. In particular, when we go through this, I'm going to be focusing on the immune system, because that's one of the most relevant portions of this section of the presentation for you to understand the role of the stress response. Now, stress is a really big deal. Okay, it doesn't get its kudos. It doesn't get the attention that it deserves for how much it influences our health, our happiness, and our healing. Why is that? Well, show me stress. Where is stress? It's not like a tumor growing out of your eye or your shoulder that you can see every day in the mirror and it reminds you to make changes or to do something. Stress is sort of out here somewhere. It's non-tangible. It's subjective. What stresses me doesn't stress you out. We all cope with stress differently, and it doesn't really get taken overly serious within medicine by your GP. She rarely talks to you about how you're really going on the inside. If they do, it's usually ticking boxes, and if it's too much, they'll just refer you off. But very often those conversations don't even happen. But stress is a full body, major physiological and psychological event within the body. Not one cell, not one organ system, organ, tissue, nook and cranny of the body goes unaffected when you're under stress. So when you get stressed, there's a whole host of chemistry that gets released into your body. I call it the chemistry of stress. Very original, I know. This involves hormones, like powerful hormones like cortisol and adrenaline, and inflammatory cytokines, these chemicals that flare the body up. These get released as well. And there's all these neurotransmitters depending on what emotions are associated with it. So this chemistry gets liberated into your body, and it permeates every single cell, and it can enhance healing depending on what type of stress it is, or it can hinder healing. And most of the stress that we get these days isn't the acute stress that helps to strengthen the body. It's the chronic, persistent stress. So we're not chasing tigers like the one on the screen. Or the tigers aren't chasing us. We've got multiple tigers in disguise. The bank balance, the bank manager, the hubby, the wife, the kids, the finances, the this, the that, multiple tigers, stacks on, all on top of us. Chronic, persistent stress. This is the one that wears and tears the body and wears us out and creates massive immunological dysfunction. So let's have a look at how this works. And to understand this, we need to go into this big long word. It's Psycho-Neuro-Immunology. Okay, so it's a big long word, or they call it PNI. Now, this is the whole field of science. It's probably at least 20 years old, that has a look at the role of the psyche, so our emotions, how we interact with the world, the mind, how it influences our nervous system, the neuro bit of this word, psycho, neuro, and how that nervous system then controls the immune system. So essentially, it's the role of the mind on your immune system. So the role of stress, because stress impacts our mind massively. It's basically the study of stress and how it impacts our nervous system, which controls our immune system. So how does the immune system get out of whack just because of stress? We're going to deep dive into this now. So let's have a look. To understand this, we have to look. Oh, hang on, get a bit too far ahead of myself. So let's have a look. The interconnected of our system. So the same biochemical messengers that communicate needs and feelings also regulate the function of our immune systems. So these messengers are called the neuropeptides, little protein molecules. So from years of findings in P&I research, it shattered the myth that negative emotions cause immune dysfunction. So the bad emotions are bad for you, and the positive emotions are good for you. So it shows that that wasn't correct. So the critical importance is how you express those emotions. Do you voice them out? Do you gain support? Do you write it out, scream it out? Or do you repress it and swallow it down and stick a big happy, happy, joy, joy face on when inside says something totally different? So when your external expression and your internal experience are incongruent, they don't line up, this is where things go wrong. And this is what Psycho-Neuro-Immunology is all about. The most toxic of all stresses are the ones that never get expressed. We hide them down. Now, there's a very common personality trait within people with chronic diseases. They are the nice people of the world, typically. Okay, so the nice ones, we put the big happy, happy, joy, joy face on, and we don't burden the world with our emotions, with our stresses and our pains. Typically, that's an adaptation from early childhood where it wasn't safe to express emotion. So we learned from an early age that we repress emotion. I know this story very, very well. Now, the problem with that is that we don't express our frustrations, our anger, our resentments, whatever it is, and it stays in these toxic emotions with this toxic chemistry that I talked about, hurting our body, influencing our immune system. So we must learn how to express. And the people that get chronic diseases, typically, they're not very good at this. It's just, it's actually something that's been studied and observed over many, many decades, this chronic disease personality type. Okay, so if this is an issue for you, reach out to people to help to talk about this stuff. Use me, use a friend, use a therapist. Learn how to get comfortable with the uncomfortableness of what's inside. So Psycho-Neuro-Immunology allows us to understand this. Okay, so people that chronically repress these emotions, so hide them away from the world, it influences our immune system. And the immune system does one of two things. It gets hypersensitive and overreactive with a tendency towards the allergies, including self-allergies or autoimmune conditions, or it can go the other way. And we're going to see this very, very soon, how this works, into a hyposensitivity, underactivity, so susceptible to infectious diseases and diagnosis of cancer. When we have a look through the polyvagal lens, you'll understand why this is. And we are here at the vagal. So to understand polyvagal theory and the way that stress influences your immune system, we first have to understand what the vagal nerve is, because it's a really crucial part of the way that we deal with stress in the body. So the vagal nerve is actually cranial nerve 10. It manifests or originates out of the brainstem. As you can see on the picture on the right here, it extends down through the chest with not a lot of activity. And then it goes down to the abdomen. Now you can see at that bottom third of that image, look how much nervous system activity there is. They're all nerve endings. What part of the body do you think that is? That's the intestines, that's your gut. That's why your gut is the best barometer of your stress and why most people feel stress in their gut, because look at all the nerve endings in there. It tells you your stress levels are communicated through your gut, and your gut tells you about your stress levels. Most people experience this. Okay, so the vagus nerve, I think the root term is something in Latin that resembles wanderer. So it's this wandering nerve that goes throughout the body. So this nerve is the body's major parasympathetic nerve. So there's two parts that we're going to explore really deep. Actually, three parts we're going to explore really deeply when we talk about stress. The different nervous systems that calm us down or pump us up ready for stress. We have the sympathetic nervous system that drives the fight or flight response, that mobilizes and gets the body energized to fight, to flight tigers or warthogs or elephants or whatever it is back in the day. These days, we've got warthogs in disguise, the hubby. So the sympathetic nervous system puts the foot down on the accelerator and drives the body into activation for survival. Now, the thing that calms the body down is this parasympathetic nervous system, which the vagal nerve is a massive part of that. So the parasympathetic nervous system is the rest and digest. It's the brake and self-regulation and the healthy regulation of our stress response of our nervous system is how we apply the accelerator and the brake in effective ways. Now, many of us can't do this very well. We weren't modeled it. We weren't taught it. Life's highly stressful, so they get a workout. They get weak, they get vulnerable, they get fragile, and they get really trigger happy sometimes. We're going to explore this in a second. So that's the vagal nerve, very, very important nerve. This nerve can be trained, as we'll talk about really soon when we look at the usable information from this presentation on what you can actually bring to your life. I don't want this just to be about information that I'm just vomiting at you. I want you to actually be able to do stuff with this information, and we're going to get to this after this section here. So let's have a look a little bit deeper into this. Let's have a look at the stress hierarchy, how your body does stress. And in this, I want to show you how your stress then impacts your immune system. So to understand this, I have to tell you a story, okay? And the story is about one of your ancestors. It's about 20 to 30,000 years old, this ancestor. His name is Uncle Ugg, the caveman. Okay, now Uncle Ugg had a pretty cruisy life, okay? He lived in clans or tribes of about 20 to 50 people. He had a working day of 2 to 3 hours. So it was a 15 to 20 hour working week. And that was hunting, that was gathering. Pretty cruisy life. I would like that. Thank you very much. So most of his day was spent relaxing, connecting, storytelling, grooming, procreating, not doing a lot, a pretty cruisy life. Okay, so most of his day was spent in this first stage of the vagus nerve, which is called the ventral vagal. This is our safe mode. This is where things feel good. We feel balanced. Our body is in homeostasis. We are socially engaged and everything just operates lovely and fine. This is the newest part of our nervous system. So if we had to look at the development of the nervous system back from when we were some fish-like creature to the modern form of humans that we are now, 200 million years ago, that's a long, long time ago, the ventral vagus was developed. Okay, this is part of the parasympathetic nervous system. This is the rest and digest, safe. The operative word here, the key word, remember nothing else is safe. Okay. Okay, but this is where things feel good. But then we hear somebody creeping up on the clan, on the tribe. It's Toothy the tiger, the saber-toothed tiger, and she's hungry. She hasn't eaten for a few days and she smells caveman, and it smells probably pretty average, but to her probably felt pretty good or smelled pretty good. And then the body had to jump into gear. The sympathetic nervous system kicked in. Remember, this is the part of the nervous system that's the opposite to parasympathetic. This is the thing that gets us going, gets us mobilized, gets us ready for fight, for flight. Blood starts pumping to our extremities, to our muscles, to our brain to be sharp and on the ball, fast and strong and quick. Okay, we get anxious, we get vigilant. There's an immune activation in this in this stage of the stress response. Okay, we'll talk about that a little bit more in a second. So the sympathetic nervous system is an older part of the nervous system. It's about 400 million years ago. Okay, and it's designed, the key word here is mobilize. It gets the body ready for action, to run, to fight, to survive. Okay, now part of this, millions and millions of years of evolution, 400 million years of evolution, is that our nervous system knows very, very well that Toothy the tiger has claws, and underneath Toothy's claws are lots of bacteria, probably funguses and all sorts of yucky stuff. So when there's injury, which is highly, highly likely in fight or flight situations, that there's going to be a very, very high infection risk. So through genetic evolution, selection would have chosen to activate the immune system in fight or flight situations. Now, back to the immunological scales. Which one do you think is going to go up? The cell-mediated, antibacterial, viral, fungal cancer activity, or the humoral, the B cells? Which one's going to become predominant in this sympathetic nervous system fight or flight response? Correct. Absolutely. It's going to be the cell-mediated antibacterial, viral, fungal activity, because that's going to be really important with those clawings, or if you're running away and you trip over and you stub a toe on a rock or on a log or something like that, we need that overactivation of cell-mediated immune system to guard against infection. Infection would have been, back in the day, would have been the biggest killer by far. We did medicines back then, or maybe some herbal medicine, things like that, but infection would have absolutely been the biggest killer. So this is what the sympathetic stage 1 of stress: run, fight. Two options. Now, we choose to run. So Uncle Ugg starts to sprint away and Toothy's on the chase. Now, there comes to a point where I'm assuming Toothy the tiger's got better cardiovascular health than Uncle Ugg did. He could only last for so long. And now Toothy's got Uncle Ugg cornered up against a rock. Now he's absolutely cactus because he's been running for too long. He's knackered and his body now goes into a different stage of the stress response, a deeper stress response where death is probably imminent, and the last ditch effort to survive is called the freeze response. So let's have a look at that. So the freeze response is regulated by a different part of the vagal nerve. Okay, it's called the dorsal vagal. Now, the dorsal vagal is that bottom third of the image that's in the middle of the screen. So from all that nervous system activity in the gut, that's the diaphragm just above there. So the diaphragm downwards is where your dorsal vagal kicks in. It's the immobilized response. Keyword: immobilize, freeze. If Uncle Ugg doesn't move, he barely breathes, he barely makes a noise, hopefully Toothy gets bored, or something else gets Toothy's attention that looks a little bit more delicious than smelly old Ugg, and she runs away and he survives. But it's this last ditch effort. So in this response, energy drains from the body. It's all about conservation of energy. Energy gets drained from the periphery back into the viscera, the organs, to try to keep them going. So we feel exhausted. There's a disassociation that happens psychologically for the impending death or pain that may be coming. So we disconnect from our emotions, from our physical sensations in the body. So we get a numbness that comes through the body, emotional and physiological numbness. And in this stage, when it comes to the immune system, there's an exhaustion that happens. So we flip over to a predominance in the humoral immune system. That cell-mediated immune system, the way I like to think of it, can only fight for so long. How long can you fight or flight before you get exhausted? That immune system can only do it for so long. And then the immunological scales shift, and you see this with people. And then there's the side effects of that immune suppression when it comes to cell-mediated, which is chronic infections, systemic autoimmunities. So this is the oldest part of our nervous system, the dorsal vagal. It's 500 million years ago. So depending on how we traverse up and down through this hierarchy, so imagine this as a ladder. Our ability to climb up and climb back down and regulate which parts we're in is the most important thing for the way that we deal or interface with stress. Now, most people aren't skilled at controlling their stress response. It hasn't been mirrored to them. We don't talk about it. It's not taught in school, all things which are just criminal in my opinion. But we're not skilled with this. And so sometimes the nervous system goes, oh, no worries, mate, I'll take over for you and I'll drive the bus. And we're going up and down through this hierarchy in a very erratic way. That's exhausting. Symptomatically, we've got all sorts of symptoms going on. And immunologically, which is most important for you if you've got an autoimmune condition, is that there's immune overactivation in that sympathetic nervous system predominance. Depending if you're stuck in that state there, you're going to have tissue-specific autoimmunities. So looking at this through the immunological lens, or if you've dropped down in a deeper state of immune activation to exhaustion, and now you're stuck in the dorsal vagal realms, and you've got this exhaustion of the immune system, you're now in a systemic autoimmunity state. So what we need to learn is how to bolster this whole system, regulate the system. Now, these are the three states. Now, believe it or not, there's actually combination states as well. If you combine the top one, ventral vagal, with the sympathetic in the middle, that combination is called playfulness. We all enjoy that. You can also bring in the ventral vagal and the dorsal vagal at the same time. So you feel socially engaged, you feel calm, you feel safe, yet you're in a dorsal where you can go totally floppy and exhausted and the body just drains. That's when you're sitting on the couch with your beloved, watching some Netflix, and you're super safe and you just feel so calm and relaxed. You can just be there in the blissfulness of it. That's that beautiful state. So there's lots of different states, okay? But what we need to understand is that this system can get highly fragile. If you've worked the system, you've climbed up and down the ladder lots through your life. Let's say you've had quite a traumatic life. You've had lots of death around you, death in the family, marriage breakups, financial demise. Maybe you've had a traumatic childhood, all sorts of things. A trauma background plays a big part in this as well. Strong trauma background. You have a very sensitive system, and your immune system reflects that, very sensitive immune system. This can be trained. You can work with professionals like myself that can help give you the tools, and also herbs are beautiful. This we'll talk about soon, to help strengthen the system. There's things you can do to actually start to master your nervous system. So the nervous system's not driving the bus, you can take the wheel. Okay, and this is really important, because if you're not, then it's driving the bus, and it's driving the bus for your immune system, and you're going to feel like you're in a body that you can't control, an immune system that you have no say over whatsoever. You can tame it. And that's why this presentation is called Taming the Immune System. It is tameable. Let's keep moving. Okay, so what do we do to tame this nervous system then, hey? So we can retrain and tone the vagal nerve. So think of the vagal nerve as a muscle. You can develop bigger biceps on your vagal nerve. So a key point is, if we have a lot of stress in our life, medicine has a term for this. Get all your stresses, your physical stresses, your mental, emotional stresses, your social stresses, financial stresses, familial stresses, pop them into a basket for me. Now get that basket, if you can even pick it up, and pop it on an industrial set of scales. You're going to need an industrial set of scales here. What does it weigh? It's probably pretty heavy. Most people's are in the modern world. That weight, that load that's in your body of your stress is called allostatic load. It's the medical term for it. So it's the lump sum of all your stresses and the wear and tear it's having on your system, on your body, hormonally, immunologically, endocrinologically, which is your hormones, neurologically, psychologically, everything. It has a massive wear and tear on your body. Now, if your allostatic load is way too high, I'm really sorry, but there is no herb, no medicine, no therapy that's going to fix that at all. There isn't one. It's just impossible. You cannot fix a condition with the same conditions that created it. So what does this mean? We have to make meaningful change in our life. We have to look at these big high return on investment tiles that might be part of your disease picture and just go, wow, my marriage is really suffering. I really need to work on that. Have some courageous conversations. Go to marriage counseling. Take radical responsibility for your part in the issues. Make some changes. Work on your mindset, the way that you deal with stress, the way that you deal with conflict, and decrease the allostatic load. It might be that you're doing too much work, as in your working week is just too long. Remember Uncle Ugg? What was his working week? 15 to 20 hours, 2 to 3 hours a day. Heaven. What are you doing? 40 hours, 60 hours, 80 hours plus? Your body can't do that. No, it can do that for a short term, but it can't do that long term. Something will crack, and that will be your body and your immune system. So we have to look at these areas of our life and go, is it worth it? Is the payoff of leading these overly complex lives, these complex shows, keeping them on the road, is the payoff worth it? In most cases, it's not. So we have to choose to make some changes, maybe choose a little bit of a simpler life. Sell the house, downsize, free up some equity in that, some finances in there to lead a calmer life where you don't need to work so much. It might be I'm totally unenthused by the job that I do, and change, do something different, get a new skill set if that was what you need to do to start changing. Look at your balance. It's a really, really tricky thing to do. We don't like change. Human beings just don't like change. But disease often comes along because it's not happy with, remember, what I call the epigenetic environment. The chemistry of your life isn't conducive to health and happiness. It wants change. This is why disease is in your life, because it wants change in your life. Make the changes. You can try to force the changes. You can try medicines and you can try supplements and spend a fortune in the process, but you all know they don't work because you've done it. I guarantee it, you've been already doing it for probably many years, chasing the elusive supplement that says it'll get rid of autoimmune conditions or medical marijuana or this or that or that. Now, I'm not saying that these things don't have value. They absolutely have value when done in the framework that's conducive to getting the outcome, which is your life. If you don't make the changes in your life, you'll be pushing shit uphill, to be frank. So make the meaningful change. Honestly, the people that get the best results are the ones that change the way they do life. So easy, he says. Okay, stress management. We can work with that. You do stress in a certain way. It's your coping strategy. You learned this in childhood because of the environment you grew up in. Sometimes that's not the best way to do stress, but it was the perfect way when you were young, and maybe it's not serving you anymore. You can change that. You can become aware of that. You can learn new coping strategies. So this is a lot of work that I do with people, is to get people to understand where the goggles of their life came from, the lenses that they view their life through. That can be understood, and your relationship to it can be changed, which changes the whole game of life. And then you can work on your specific stress coping strategies. And that could be things like breath work, meditation, mindfulness, lots of beautiful little techniques that can have massive impact on your life. What's this next point? Work on resolving triggers, traumas. I've touched upon that. Your early childhood experience, the soil that you were raised in, so the household, what the dynamics were in the home, your mum, your dad, their traumas, your bloodlines, the multi-generational nature of trauma and stress, and how this echoes through your life and probably your children's life if you've got children. This stuff can be understood, and we can work on helping to get freedom from that, the trauma that sometimes flows through as a legacy from our ancestors. Okay, it's tricky work, it's deep work, it's emotional, but it's highly, highly worthwhile doing. You have massive impact on your life when you can clear that early wounding, pain that we all carry. We all carry it. And this influences the way that we interact with our relationships, our job, our kids, even ourselves. So we can gain a better understanding of that and have a look at our relationship we have to this and start to work on a healthier relationship. If you need help there, please reach out. This is the stuff that I love doing, if you can't tell. Resilience training. What is that? Hormetic stresses. This is stuff that I love to do as well. This is if you follow me on the socials, you see that I like to throw people into, well, I don't actually throw people in, but I invite people to hop into ice bath. Okay, really extreme situations that put an acute stress on the body, not a chronic persistent one over years and decades. This is the short-term acute stress, 2 minutes, 5 minutes, something like that, where the body rises up into a fight or flight response, and you have to hold your physiology to calm it down. So your ability to put your body under stress and hold your physiology in that stress. This is called resilience training, or the more technical term is hormetic training. So hormesis is a full body major adaptive response that your body does to strengthen itself. So what doesn't kill you makes you stronger. Most of Uncle Ug's stresses in his life were short-term acute hormetic stresses, okay? Most of our stresses in modern world, modern Ug, is chronic, persistent, long-term stress. So our body loves short-term stresses where it has to rise up to challenge it. When used appropriately, you can train your vagus system, your vagal nerve, to be stronger. Now, this doesn't mean you need to go buy a million bags of ice and fill up a wheelie bin and jump in it. You can just start with some cold showering. Now, I don't mean a full cold shower from woe to go. Have your beautiful warm shower and do all the things that you do in the shower. But then at the very end, challenge yourself for maybe just 10 seconds and just put a little bit of cold in. Doesn't have to go full cold, just a little bit. And the key is get it to the point where it challenges you. But in that challenge, hold yourself solid. Hold your breath, calm, 5 seconds in, 5 seconds out. Don't let shivers kick in. Just hold your physiology. So the stress comes in, hold, hold, hold. It's all about the hold and how you hold your physiology in the face of stress. Now you can do that. Sauntering is another example of this. The type of exercise that you do if you're a gym goer, you can do intermittent training. So high intensity interval training. That's a best way to exercise. Short bursts of maximum effort, then lots of rest time. Short bursts, it's all about the short acute stress nature is the ones that your nervous system loves. And you can train and get more resilient in that. So try these things out. If you need more info, reach out. Google hormetic stress or hormetic stresses, resilience training, these sorts of things, and you should get some ideas on what to do there. I mentioned herbs can be great. Herbs are very system specific. There's herbs that are beautiful for the adrenal glands, for your stress, what's called the HPA axis, which is how your body does stress. There's beautiful herbs that strengthen the system. There's nutrients, there's all sorts of supplementation when prescribed in the right way can be of great benefit, but only when your environment is conducive to getting the outcome that you want. So you must make the changes in your life to decrease allostatic load. Key point, get your environment conducive to getting the outcome, then introduce these beautiful elements like herbal medicine, hormetic training, some other supplements, things like that. You will get such better results when you do it in that way, rather than force the healing. You can't force healing, it doesn't happen. You've got to create space for healing. And sometimes that creating space is actually knocking down roadblocks that are in the way, which might be the job, the marriage, the this, the that. Understand? Let's keep going. Right, what's next? Some practical ways to balance your immunity. So we can look at our dietary approach. So a low reactive hypoallergenic diet is always going to be good when you have an autoimmune condition. So what does that look like? So lots of vegetables, lots and lots of veggies, lots of, or maybe moderate amounts of fruit, not too much, but a little bit of fruit. If you're eating animals, then very, very good quality grass-fed, pasture finished animals in small amounts. Don't overdo the protein. Most people smash way too much protein in their diet. It's just not necessary. Lower amounts of protein, lots of plant life, a little bit of nuts and seeds. And most people typically do a little bit better with less grains and legumes, things like that. So you can experiment, see what your body likes. Your body is the best barometer of your diet. It'll tell you what it likes and doesn't like. But a good place to start is a low reactive diet. Lots of veggies, a little bit of fruit, a little bit of animals if you're eating them, and looking at your main dietary allergens, keeping them as low in the diet as possible. So your main #1 dietary allergen is dairy, cow's milk. It's not designed for humans. It's incredibly immunologically complex. It's designed for cows, again, not humans. We don't do well with it, most people. It's highly allergenic. And if you've got an immune system that's already overactive, why burden it even more? So you're best to cut down, find alternatives. So many other healthier foods to dairy milk, like any of your other nut milks. They may not have the nutritional profile, but you shouldn't be getting most of your nutrition from milk anyway, or any milk source or nut milk source. It's a complement to the diet that you might put in your smoothies or something like that. Your #2 dietary allergen is eggs. So hen's eggs, poorly farmed hen's eggs, caged eggs, things like that can be quite allergenic. For some people, that can cause problems. The third dietary allergen can be gluten. The best way to find out if these things are allergens to you, and this is a key point, if you're not reacting immunologically to it, it's not an allergen for you. How do you know this? Well, you can tell generally by some symptoms sometimes. Now, the symptoms can pop up 2 to 4 days post eating the food, so it's very hard to track. Sometimes the easiest way is to actually do allergy testing on the food, which can give you a little bit more insight quicker to streamline your diet. So if you want some information or you want to do some food allergy testing, please reach out. We can really dial your diet in very quickly doing it that way. Nutritional factors, some other practical ways to balance the immune system. We talked about vitamin D, super important. If you just do one thing today, get your vitamin D level checked, please. Remember, 150 to 200 nanomoles per litre would be a great place for you to sit. If it's anything lower than that, reach out to me and I'll give you advice on what to take for how long. We want lots of antioxidants in the diet. Lots of essential fatty acids, the oils, the beautiful oils in our diet, the avocados, the flaxseed oil, fish oil, if you're taking that, high quality, high strength. These things really help to modulate the inflammation that's in the body. It's not going to take it away, but it's going to help minimize it and work with it. We can control that inflammation. Herbs can be beautiful for that. Vitamin D, like I said, we've got to calm that immune system down. This inflammation is immune mediated. It's driven by the immune system. So we must focus on the immune system. So vitamin D will help balance it. There's certain strains of probiotics which drive down and create a balance in those immunological scales. We can use those. You can use the essential fatty acids or these other very specialized essential fatty acids called SPMs, specialized pro-resolution mediators. Sounds very high tech. You can use these, a little bit expensive, those products, but you can start using them, get that inflammation down, and then switch over to the essential fatty acids. Sometimes that's a good, more cost-efficient strategy. Weight loss, we talked about that, really important. We can start working on losing weight, changing our lifestyle so we're more active, changing our diet to the approach that I recommend. We can start the process of losing weight naturally, not forcing it off, not going extreme dieting, but naturally coming off as we improve our lives and our health. We can decrease our stress. So I'm going to talk lots about that. So the psychosomatic factors, our stress levels, we've looked at that. You can see, hopefully you can see how powerful that is and how much that can influence your immune system. So we can work with stress. Again, we can look at the way that you do stress. Where did that come from? Is that appropriate? Is there a better way to do it? Can we start to work on retraining our nervous system to do stress differently? We can look at our mindset, our trauma background. Is there anything that needs to be cleared up that we're still holding inside, affecting us flesh and bones and driving, the immune system like sometimes it can do? The body says no. The body holds a lot of trauma, so we have to somatically dive in there. I do a technique called compassionate inquiry. I'm trained by Gabor Mate, MD, Canadian physician who's written many books, one including The Body Says No. Highly recommend that you watch that or even YouTube it. There's a lot of good public lectures that he's got that goes into this stuff in a lot of details, the role of stress, your internal environment, Psycho-Neuro Immunology, all this juicy stuff and how that relates to chronic disease. Just Google or on YouTube, search on YouTube When the Body Says No. You'll enjoy it, I guarantee it. So we can work on that stuff. So I'm trained by him, and it's his psychotherapeutic style of therapy that helps you to understand what's driving your triggers, your emotional belief systems, core beliefs, core wounds, gets a better understanding and helps to give you a little bit of freedom from there. So the triggers, we can start to unlearn that behavior. Very, very deep work that not everyone's up for. I totally get that. But it's very, very rewarding work if you need to do that work. And that might be part of your disease picture. For some of you, maybe it's not. Most people have a trauma background that needs to be worked on, but maybe you don't. Sleep, very, very important. Sleep is probably one of the most important things for human health. So if it's not sleeping well, we can have a look at that. There's certain medications a doctor may want to put you on. There's certain things that we can do, sleep hygiene, that we can start to work on developing really healthy circadian rhythm. So sleep is one, nourishing, helping your body to heal, and lack of sleep is not flaring your body up and creating inflammation, which it can do. We can look at your gastrointestinal health. We may need to do some testing to understand exactly what this thing is doing in you. We can do microbiome mapping where we understand exactly how your microbiome is. Essentially, it gives us a beautiful blueprint of all the bacteria, good and bad, parasites, different compounds that your intestinal tract uses, so many different metrics so we can fully understand your digestive system and what needs to happen to bring it into a healthy balance, which has a big impact, as we explored, on your immune system. Because remember, 80% of your immune system is in that last 2 foot of your small intestines, and your microbiome interface with your immune system in really powerful ways. So if that's out of whack, your immune system will be out of whack, and that can be worked on. Strain-specific probiotics, potentially having to weed out any detrimental bacteria. Some of these bacteria that we can accumulate, they actually trigger autoimmunities. So there's a whole panel within the microbiome mapping that's about autoimmune triggers through the gut. Okay, so if you want some more info, please just reach out to me. Righty, let's keep going. Almost there. You're doing really well. So here's my shameless plug. If you want some help to do this, if you want your hand held through this, if you want somebody to teach you all the things that need to be taught to you to help one support you, mentor you, coach you, get you on a protocol looking at supplements on how to balance your immune system and what makes up your mosaic of disease picture, then I have the Immunobalance program, which may be right for you. So on the program, these are the things that you can expect. We're going to determine what your factors are that contribute to your autoimmune condition. We're going to decrease inflammation and pain. So symptomatically, we need to get you in a better state so we can get some forward momentum with you. You're going to get my support naturopathically from a holistic perspective rather than do the ologist thing and just focus on your symptoms. We've got a big picture here. We're going to understand what drives your stress. So what's underneath all that, we're going to work on that, the juicy work, the deep work. You're going to learn how to master your nervous system on my nervous system mastery course. It's a 6-week online journey that we'll take together in a group. And I'm going to help support and keep you accountable for making changes to your lifestyle and your mindset for long-lasting health. Okay, so what does it involve? It's an 8-week program. You're going to have a 60-minute consult. So you get that questionnaire, you fill that out at home so I don't have to bore you with all these questions, and then we're going to talk. In a whole hour, we're going to explore your life and what's been going on in your life and why you're unwell, not what's wrong with you. The questionnaire tells us that, pathology tells us that. I want to hear it from you, and I want to see what your life's been like up until this point, from birth, even pre-birth sometimes. Talk about your parents, trauma, and all that sort of stuff, and see why this is in your life. It also involves follow-up consultations, 3 of them for 45 minutes. So we're going to make a protocol for you to follow, and then we'll have 3 follow-ups to make sure everything's working and to keep you accountable along the way. There's supplementation involved to help support your immune system. We're going to do testing. We have a either if I'm treating you online in your GP, if you're in Perth and you come to me, we have a GP at our clinic and he will assess you, and we'll have a look at certain blood tests and things that need to be looked at, discuss different medications that may be appropriate for you. But from my point of view, the natural point of view, there'll be supplementation that can help support your system and what's out of balance, whether that's your nervous system, your stress system, obviously the immune system, and how we go about supporting that through herbal medicine, nutritional medicine. And then a big part of it is through this Psycho-Neuro Immunology component. So my 6-week online program, we do it via Zoom on a Thursday night. It's called Nervous System Mastery. We're going to take a 6-week journey really, really deep into your stress response and what you do about harnessing the power of your autonomic nervous system to bring balance to your immune system. So through that polyvagal lens that we explored today, it's a really deep course I've been teaching for many, many years now. It's life-changing. It will change everything for you. Like, it's a game changer, the way that you perceive the world, the way you interact with your nervous system, your stress levels, your breath. So we explore breath work, we explore mindfulness, we explore meditation and lots of different techniques, and we're going to practice it together, which is the most important thing. So you can master your nervous system. And that's the Immunobalance program. Any questions, please reach out to me. If you want to know when the next one's starting, please just reach out. Again, if you've got questions, please reach out. I know this isn't live, so we can't ping them through and I can explore them with you. But if you do have questions about anything that you've heard, reach out, go to my website, eddieenover.com. On there, you'll see a big yellow button all over the place. It says book a free half-an-hour appointment with me. You can book a time. We can have a chat on the phone if you do have questions, or if you want to just suss me out a little bit more before coming in for a consult, that's totally cool as well. That's what that service is there for, is just to make a first contact, have a chat, see how I can help you, and also for me to see if I want to work with you. I only want to work with people that want to make these changes in their life, to make lifestyle changes, the stuff I've been talking about. I'm not into magic pills. I don't want people to come, tire kickers that want to try a few things and not make changes. That's not who I want to work with. If you like the sound of that, you're ready to do some work, then reach out, let's have a chat, and let's get the ball rolling, okay? And that's it. Don't worry about these dot points here. I just want to thank you for getting through this, however long that went for. I need a drink. You probably do too. Any questions, please reach out. I hope you enjoyed.